Hi, my name is Kelvin, and this is Nursing Foundation 2 lab assessment, staple removal, and dressing change. Before you start off with anything, you want to do hand hygiene. And if your hands with alcohol based product, and if your hands are visibly soiled, you want to wash it with soap and water. And once your hands are dry, it's time to start the procedure, and you want to do it by starting with the physician's order, which is remove alternate staples from right leg today, apply stair strips and cover with sterile 4x4 gauze dressing. Remove remaining staples tomorrow. And once you verified the order, it's time to verify if there's any allergies. But today our patient has no known allergies, so that's good. And after that, you want to verify the information, patient's information, and you want to do that by comparing the patient's band and the physician order, and they should have the same information, the same name, hospital number, gender, date of birth, room number, and physician. And once it's all good, you can continue with your procedure. But then if it's not the same, uh, you might want to verify the order with the physician. And right now our patient is Mr. Michael Jordan, and his hospital number is 125-2569, gender is male, date of birth is 1985, August 31st, room number is BVC 701, and the physician is Dr. Susan Hale. And once you've verified everything, you want to set up your table and your patient's bed to a working height, which is the waistline. But right now, as you can see, I'm a little short on the height part, so make sure that your table and the patient's bed is always in the working height when you're doing this. And once I'm done with that, I'll don a clean glove. And after you put on your clean gloves, you want to do a pain assessment, and you want to do that by asking the patient a question like, in a range of 1 to 10, 10 being the highest, how would you rate the pain in your wound? And after that, I'm going to take off the old dressing, do it layer by layer and away from the patient's line of vision. And you want to dispose all the dressing. And once you've disposed the old dressing, you want to dispose of your gloves as well. Make sure that you're doing it the right way. And now you want to do a wound assessment. In here, you're looking for the redness, which is you can see from the staple sites. Edema, which is present as well. Ecchymosis is present as well. But there's no drainage, and it is well approximated. after that, you want to do another hand hygiene. And once your hands are dried, it is time to check your materials expiration date. Your dressing tray, your staple remover, your stair strips, and your normal saline. And for the now you're ready to set up your drape, your sterile field. And for the dressing tray, make sure that it hasn't been opened and there is no holes in it, just to make sure that it is still sterile. And you want to open it towards you. And now you want to carefully grab the green forceps and make sure not to touch anything but the green forceps. Go. And now you are ready to set up your drape. And make sure it stays on the working height, unless or else it will be contaminated. And grab the other edge by your other hand and lay it down. And carefully put all the other materials on the drape, the gauze that you will need to clean the wound. And your other forceps. And once you set up your sterile field, it's time to put your normal saline in the tray. And right now we're gonna do 3 checks for your normal saline, just to make sure that you have the right solution. And you want to do it 3 times. So first, 0.9% sodium chloride, normal saline. Second, 0.9% sodium chloride, normal saline. And third, 0.9% sodium chloride, normal saline. And the expiry date. This normal saline has been opened this morning, so it will be expired tomorrow, because normal saline only has like 24 hours to be expired. And as this one has been opened, so you wanna take off the lid and make sure that the label is you're holding the label, so that if you drip some to make sure that the lid is still sterile. Alright, and carefully pour normal saline in your tray, and make sure that you don't make a splash. And now you're ready to clean the wound. And you want to do it by using the metal forceps and the 2x2 gauze. want to clean it from drip it from in the normal saline, and clean the incision site from the inside towards the outside, one line, then dispose. And you want to keep doing this until you made sure that you are clean, that make sure that you totally clean the wound. And onto the other side, from the inside to outside again. Make sure it's one line, and then dispose, and keep doing it again until you finish. Dip it in the normal saline, inside to towards the outside, one line, and dispose. And the last one, inside to outside. There you go. And once you finish cleaning the wound, it's time to take off the staples. And before donning your clean gloves, you wanna do another hand hygiene. And once your hands are dried, it's time to put on your clean gloves. Grab it by the edge, dispose. And for putting your sterile gloves, you want to put on your dominant hand first. But before you put on your gloves, make sure that you set up your staple remover and your steri strips. So open it. Make sure you're not holding it. And dispose. Open. And now you're ready to put on your gloves. And put the dominant hand first. Make sure you're only touching the inside of the gloves. There we go. And for the non-dominant hand, you wanna grab it by holding the outside. As you can see here, I'm not holding the inside part. And put it on. And before you take off your staples, you wanna set up gauze right beside it, so you can put the staples on it and keep track of the staples. And yeah. So on this part, I'll take off 3 staples as per the rubric, and I'm gonna do it by alternate, starting with the second one. Carefully put your staple remover on the staple. Shake it a little bit and then pull. And make sure that your staple is not touching the skin to maintain sterility. Same procedure, squeeze a little and pull. And the last one, shake a little and then pull. And as you can see, I took off 3 staples. There is 6 remaining. And now I'm ready to put my stair strips. And be careful on putting your stair strips. Make sure that you're maintaining sterility of your items or materials. And after you're done putting your stair strips, it's time to reapply the new dressing. And as per the doctor's or the physician's order, apply new 4x4 sterile gloves and secure it with the secure it. after you've secured it, make sure to put the date, the time, and your initial on the new dressing, just so everyone knows who. That's so it's documented. And count the count the staples that you've taken off and dispose it in the sharps container. And right after that, it's time to clean up. Everything's good. And take off your gloves the proper way. Then do another hand hygiene. And next step is patient teaching. I'm gonna teach my patient how to change the dressing, clean the wound, reapply new dressing, and I'm gonna tell him about the stair strip, not to take it off because it will take off after it will automatically peel off after 10 days. And I'm gonna provide the call bell within reach of the patient, so if he has any problem or question, he can call someone. I'm gonna make sure to lower the bed again and put the bed rails up. I'm gonna ensure the comfort of the patient. And after that, I'm gonna do a hand hygiene before I exit. And that's all.